For many men over 60, sexuality often becomes a silent subject, surrounded by outdated myths and unnecessary embarrassment. Yet, private pleasure, especially masturbation, remains a natural and important part of overall well-being, regardless of age. If you're over 60, you may wonder, is it safe? Are there hidden health risks? And how can you enjoy self-pleasure while keeping your body protected? I'm Dr. Isabel Lopez, a urologist with over 25 years of experience. And where are you watching from? Drop it in the comments, and stick around because I have a surprise for you at the end. In this video, we'll break down the realities of masturbation for senior men, what changes, what stays the same, and why it matters more than most people realize. Many believe sexual health declines automatically with age, but modern science tells a different story. With the right information, pleasure and safety can go hand in hand at any stage of life. You'll learn why masturbation is not only safe but also beneficial for physical and emotional health, and how to avoid common mistakes that might lead to discomfort or injury. We'll also highlight when it's time to seek medical advice, an essential step for protecting your long-term wellness. Ready to challenge misconceptions and take control of your own sexual health journey? This is your guide to safe, satisfying self-care after 60. Follow the channel to make sure you never miss the content that matters most to your well-being. The aging process brings about changes in nearly every part of the body, including the sexual organs and how they respond. As men cross into their 60s and beyond, it's normal to notice shifts in sensitivity, arousal patterns, and even the time it takes to reach orgasm. These changes aren't a sign of illness, but rather a reflection of evolving hormones, blood flow, and nerve function over time. Lower testosterone levels can mean reduced libido or a longer recovery period between erections. The skin of the penis may become thinner, drier, or less elastic, making it more susceptible to irritation or small injuries during self-pleasure. Some men experience decreased firmness or changes in the way ejaculation feels, while others find pleasure in new or different types of touch. Prostate health also starts to play a larger role. An enlarged prostate, a common condition in older men, can affect the quality of orgasms or make masturbation slightly less comfortable. Urinary symptoms, like needing to urinate more frequently or feeling a weaker stream, can sometimes intersect with sexual function, requiring patience and adaptation. Despite these adjustments, sexual activity remains both possible and pleasurable. Understanding your body's natural evolution is key to staying confident and comfortable with self-care. Open conversations with a trusted healthcare provider, like a urologist, can help clarify what's normal and what might need extra attention. Some men may feel embarrassed or frustrated by these changes, but acceptance is empowering. Instead of focusing on what's different, learning new techniques and adjusting routines can enhance both safety and satisfaction. A flexible mindset, combined with good information, helps transform age-related changes into opportunities for discovery. Physical changes are just the beginning. Why does focusing on safety during masturbation matter so much as you age? The next segment will uncover the reasons and the rewards of keeping your self-care routine both mindful and secure. Safe masturbation is about more than avoiding discomfort. It's a fundamental part of protecting your health as you age. While masturbation remains one of the most natural and risk-free sexual activities, changes in skin texture, circulation, and sensitivity after 60 mean that caution becomes more important. Even minor friction or dryness can lead to small tears or irritation, which, if left unchecked, may develop into infections or persistent discomfort. By adopting safe practices, men can preserve both pleasure and well-being. Simple habits, like choosing a comfortable environment and using gentle techniques, can make a significant difference. Paying attention to your body's feedback, any pain, burning, or unusual symptoms, ensures that small problems are caught early, long before they become bigger issues. This proactive approach is essential for maintaining confidence and peace of mind. Safe masturbation also means being mindful of any underlying medical conditions. Diabetes, cardiovascular disease, and certain medications can influence how the body responds to sexual stimulation. For instance, some men may notice increased dryness, slower healing, or a higher risk of skin irritation. Being aware of these factors and discussing them openly with a healthcare provider enables you to tailor your routine to fit your specific needs. Another key aspect is hygiene. Clean hands and a well-maintained environment reduce the risk of introducing bacteria or other irritants. This is especially important for men who may have a suppressed immune system or existing skin sensitivities. Good habits go a long way toward making masturbation both safe and enjoyable. Lastly, safety is about mental comfort too. Worrying about potential problems can interfere with pleasure and relaxation. When you trust your routine and know you're taking care of yourself, the entire experience becomes more satisfying. So, what practical steps can you take to protect your skin and maximize comfort during masturbation? Next, we'll explore the essential role of lubrication and skin protection for men over 60. Lubrication is one of the simplest yet most effective ways to prevent irritation and injury during masturbation, especially for men over 60. As the skin becomes drier and more delicate with age, relying solely on natural moisture can lead to friction, microtears, and discomfort. The use of a high-quality, water-based or silicone-based lubricant can make self-pleasure not only safer but also significantly more pleasurable. Avoid products with strong fragrances or unnecessary additives, as these can increase the risk of allergic reactions or sensitivity. Choosing the right lubricant is crucial. Water-based lubricants are easy to clean and gentle on sensitive skin, while silicone-based options last longer and require less frequent reapplication. Both types have their benefits, and personal preference often plays a key role in the decision. For men prone to allergies or skin conditions, hypoallergenic formulas are strongly recommended. Beyond lubrication, gentle techniques and slow movements reduce the chance of injury. Using too much force or rough handling can cause abrasions or even minor bleeding, problems that may take longer to heal with age. Listening to your body and adjusting your approach ensures ongoing comfort and safety. Skin protection also involves regular self-checks. Look for any changes in color, texture, or the appearance of small cuts or bumps. Early detection of unusual findings can prompt timely medical attention, preventing complications before they arise. Consistency is the foundation of good self-care, so develop a habit of examining your skin both before and after self-pleasure. Proper hygiene matters as well. Washing hands and genitals before and after masturbation helps prevent infections and maintains a healthy environment. Drying thoroughly is just as important, as residual moisture can encourage irritation or fungal growth, especially in older men with looser skin. While lubrication and skincare create a safer foundation, there are common mistakes that can still undermine your well-being. What are the pitfalls to avoid, and how can you sidestep them? The next segment reveals the habits every older man should leave behind. Even experienced men can fall into habits that put their health at risk, especially as their bodies change with age. One frequent mistake is ignoring the need for lubrication, assuming that natural moisture will suffice. As skin loses elasticity and hydration, this oversight often leads to chafing, small cuts, or persistent irritation, outcomes that can be easily prevented with the right products. Another common error is rushing the process or using too much force. While quick movements may have been comfortable in the past, older skin is thinner and more fragile, requiring a gentler approach. Taking your time, exploring new rhythms, and focusing on sensation rather than speed can transform self-pleasure into a safer, more enjoyable experience. Neglecting hygiene is another pitfall. Not washing hands or genitals before and after masturbation increases the risk of infections, especially in men with underlying health conditions such as diabetes. Simple routines, like cleaning with mild soap and water, offer effective protection and peace of mind. Some men ignore early warning signs like redness, soreness, or swelling, hoping these symptoms will go away on their own. In reality, prompt attention to small issues prevents them from escalating into bigger health concerns. Self-awareness and regular self-exams are powerful tools in maintaining long-term sexual health. Using inappropriate objects or household items as makeshift lubricants or aids is another mistake to avoid. Many substances not designed for intimate use can irritate the skin, disrupt natural balance, or even cause infections. It's always best to stick to products intended for sexual wellness. By steering clear of these pitfalls, older men can continue to enjoy safe and satisfying self-pleasure. But beyond simply avoiding mistakes, what positive effects can masturbation bring to your health after 60? The next segment uncovers the science-backed benefits of maintaining this important aspect of self-care. Masturbation is more than just a private pleasure. It offers real, science-backed health benefits, especially for men over 60. Regular self-pleasure can help maintain prostate health by promoting fluid movement and reducing the risk of congestion or infection. This routine activity may also lower the chances of developing certain prostate conditions, providing a simple form of preventive care right at home. Physical relaxation is another major advantage. Masturbation helps reduce tension, ease muscle tightness, and encourage better sleep, effects that become even more valuable as the body ages. The release of endorphins during orgasm creates a natural sense of well-being and can help alleviate mild feelings of anxiety or sadness common in later life. Maintaining sexual activity, even solo, supports blood flow to the pelvic region. This can contribute to better erectile function and keep tissues healthy, reducing the risk of discomfort or atrophy over time. For men who experience occasional difficulty with arousal, regular masturbation offers a non-threatening way to explore what still feels pleasurable and adapt to new sensations. Self-pleasure also strengthens a man's understanding of his own body. By noticing changes in sensitivity, performance, or comfort, older men can detect early signs of health issues and address them proactively. This kind of self-awareness is a cornerstone of men's health, especially as the body continues to evolve with age. There are emotional benefits, too. Masturbation can boost self-esteem, reinforce a sense of independence, and provide a safe outlet for sexual energy. For men who may have lost a partner or find intimacy challenging, it offers a way to remain connected to their sexuality and maintain a sense of vitality. Despite all these positives, it's important to recognize when something doesn't feel right. How can you tell if it's time to seek professional help? In the next segment, we'll outline the warning signs every senior man should watch for. Being attentive to your body's signals is essential for safe and satisfying self-care, especially after 60. While most men can enjoy masturbation without problems, certain symptoms should never be ignored. Persistent pain, burning, or soreness during or after masturbation may indicate an underlying issue such as infection, inflammation, or an undiagnosed medical condition. If discomfort does not resolve within a few days, seeking advice from a urologist is the wisest move. Visible changes in the skin, such as unusual redness, swelling, blisters, or sores, also warrant professional evaluation. These symptoms might result from minor injuries or allergies, but they can sometimes signal more serious problems, including skin infections or even precancerous conditions. Early intervention allows for simple treatments and helps prevent complications. Bleeding during or after masturbation, no matter how minor, should always be investigated. While older skin is more prone to small tears, repeated episodes of bleeding are never normal and deserve prompt attention. The same applies to unusual discharge, persistent itching, or foul odors, all of which could be signs of infection or irritation that require targeted care. Difficulty achieving or maintaining an erection, especially if it occurs suddenly or is accompanied by other health changes, may indicate issues with blood flow, hormone levels, or nerve function. These changes can sometimes be early markers of broader health concerns, such as diabetes or cardiovascular disease, making it important to discuss them openly with your healthcare provider. Any lumps, bumps, or hard areas that don't resolve on their own should be examined by a professional. While most are harmless, only a doctor can rule out rare but serious conditions. Regular checkups are a smart way to catch problems early, ensure peace of mind, and keep your sexual health on track. Join the Members Club and leave a super like if you value practical advice that helps protect your health and well-being. Next, we'll explore how masturbation can impact not just the body, but also the mind and emotions of senior men. Masturbation's benefits aren't limited to the physical, they extend deeply into psychological and emotional health, especially for senior men. As life evolves and circumstances change, maintaining a positive relationship with one's sexuality supports confidence, resilience, and emotional stability. Self-pleasure provides a private way to release stress, manage anxiety, and tap into moments of calm and satisfaction, even during times of loneliness or uncertainty. For many older men, changes in partnership status, health challenges, or shifts in daily routine can lead to feelings of isolation or lowered self-esteem. Regular masturbation helps reinforce a sense of independence and agency, offering reassurance that sexual pleasure remains within reach at any stage of life. This personal autonomy can lift mood, encourage optimism, and provide a welcome break from daily pressures. Engaging in healthy sexual routines has been shown to improve sleep quality and even sharpen cognitive function. The hormonal release and relaxation that follow orgasm help regulate stress hormones and support a more balanced emotional state. For men navigating life transitions, such as retirement, loss of a partner, or new health realities, these effects are especially valuable. Emotional well-being is also closely linked to self-acceptance. Recognizing that sexual desire and pleasure do not have an expiration date can free men from shame or guilt, replacing those emotions with pride and appreciation for their bodies. Open conversations, whether with a partner or healthcare provider, further normalize these experiences and encourage ongoing self-care. It's important to remember that challenges such as grief, depression, or chronic illness can impact sexual desire and satisfaction. Reaching out for support from counselors, support groups, or trusted doctors can provide tools to navigate these ups and downs while preserving a fulfilling sex life. Healthy sexuality is not just about what you do, it's about how you feel and think about yourself. In the next segment, we'll look at ways to build positive routines and lasting habits that support lifelong sexual wellness. Establishing healthy sexual routines is an essential part of self-care for men over 60. Regularity, combined with mindfulness, helps turn masturbation into a source of consistent pleasure and comfort. Setting aside intentional, private time reduces distractions and creates a relaxed atmosphere, key ingredients for enjoyable and safe self-pleasure. Personal rituals, such as gentle lighting or music, can enhance the overall experience and reinforce a sense of self-respect. Staying in tune with your body is vital. Pay attention to subtle shifts in arousal, sensitivity, and comfort. Adjust your techniques as needed, experimenting with different rhythms, pressures, or lubricants to discover what feels best at this stage of life. If a routine stops working or leads to discomfort, don't hesitate to make changes. Flexibility ensures safety and maximizes satisfaction. Keeping hygiene at the forefront is non-negotiable. Wash hands and genitals before and after each session, use only products designed for intimate use, and store lubricants and personal items in a clean, dry place. This simple routine lowers the risk of infections and supports long-term skin health. Regular self-exams are another smart habit. Take a few moments to check for unusual changes in the skin, such as redness, swelling, or lesions. Early detection and prompt attention keep minor issues from developing into more serious health concerns. Remember, it's always easier to address small problems right away. Open communication with partners or healthcare providers completes a healthy routine. Discussing concerns, sharing experiences, or seeking advice creates a support network that promotes confidence and well-being. Support from others, even if only occasional, can transform how you view and value your own sexuality. As you strengthen these habits, you build a foundation for ongoing satisfaction and safety. To wrap up, let's review the key lessons learned and highlight the most important steps for lifelong sexual health. Join the Members Club. Drop a super like, follow the channel, and leave a comment sharing your thoughts or experiences. Reaching 60 and beyond does not mean leaving pleasure or intimacy behind. On the contrary, this stage of life opens new opportunities for discovery, self-awareness, and fulfillment. Safe masturbation is a practical, private way to support physical, emotional, and psychological well-being, allowing men to remain in touch with their sexuality no matter their circumstances. Throughout this journey, the most important lesson is to listen to your body and respect its evolving needs. Use lubrication, embrace gentle techniques, and maintain diligent hygiene to protect sensitive skin. Regular self-exams and openness to professional advice help catch small problems before they grow, ensuring peace of mind and continued confidence. Masturbation's benefits go far beyond the moment, supporting prostate health, relaxation, better sleep, and emotional balance. Even when challenges arise, such as changes in sensitivity or temporary discomfort, adapting routines and seeking guidance keeps pleasure within reach. Remember, there is no right or wrong way, only what feels healthy and fulfilling for you. Stay curious, experiment thoughtfully, and never let shame or outdated beliefs limit your enjoyment. Whether you're newly single, living with a partner, or simply exploring at your own pace, sexual well-being remains a valuable part of a happy, healthy life at any age. If you have questions, notice unusual symptoms, or just want reassurance, don't hesitate to consult a trusted urologist or healthcare provider. Your comfort and confidence are always worth prioritizing. Join the Members Club, drop a super like, follow the channel, and leave a comment sharing your own experiences or questions. Your engagement helps others and strengthens our community of informed, empowered men. And remember, more valuable insights are coming soon, so stay tuned for our next video.